Assessing the Male Breasts and Reproductive System, Chapter 19. Men and women have their own unique perceptions of health, and reproductive and genitourinary health and assessments are pretty sensitive topics for both the male and the female. Male assessments require essential assessments, and that does include breast assessment because about a very small population, but breast cancer does occur in the male population. So it's just as important to teach men how to perform breast exams along with their reproductive organ exams. Male breasts extend from the second through the sixth anterior ribs with the sternum, very similar to the female. Male hormones, which is primarily testosterone, does inhibit the development and growth of breast tissue in males. And an average diameter of the areola is about 1 inch in diameter. The penis is composed of 3 parts: the root, the body, the glands. The tip has nerve endings and is probably the most sensitive and involved in sexual arousal. The scrotum is covered with loose and wrinkled skin called rugae, very similar to the vaginal wall. The scrotum contains a testicle on each side, and the testes are the primary male reproductive organs responsible for sperm and testosterone production, where in the female it's the ovaries that are responsible for production of the ova as well as estrogen and progesterone. The function of male reproductive system: the epididymis collects all the mature sperm that's developed in the testes. The spermatic cord suspends the testes in the scrotum. The vas deferens stores and transports the sperm through the epididymis, and the vas deferens is really where a vasectomy happens. It's just the ligation of the vas deferens, so it's the cutting the connection. The vas deferens is similar to the fallopian tubes in the female reproductive system. The seminal vesicles transport the sperm from the testes to the seminal vesicles. The urethra transports semen during intercourse, and then the prostate gland produces that alkaline fluid to help nourish as well as protect the sperm. A male patient is learning to perform a testicular self-exam. He asks you what the testes should feel like. What should your answer be? If you said soft and rubbery, you are correct. They should also be oval shaped in size. Gender-specific health history assesses sensitive topics that may be embarrassing to the patient, just like the female population. Male patients may not feel as comfortable discussing male symptoms or concerns with a female nurse. And the history for the male assessment really should focus on different cancers prevalent in their population. Common cancers in the male population include testicular cancer, penile cancer, prostate cancer, which is probably more common, as well as male breast, which is least common, but it is considered a risk factor for cancers. And table 19.1 in your book goes through the different risk factors. It's on page 378 for each of the cancers. It's important to also collect a strong past medical and surgical history, as well as family history. You should also collect information on all their medications, what they're doing for self-health promotion, testicular self-exams, if so, when, how often, and have they started prostate cancer screening? If not, are they eligible if they're in that age range? Similar to the female population, it's important to understand, if they have a military history background. Common sexually transmitted infections can occur when either bacteria or virus enters the body, and sometimes it can be asymptomatic unless they become unless they multiply, and then they start to travel into their reproductive organs, and then they become symptomatic. Common infections, sexually transmitted that is, include gonorrhea, not so much, but chlamydia primarily, herpes, HPV, most common, HIV, as well as syphilis. When asking patients about any pain associated with the reproductive organs, we want to again use the old CARTS or the PQRST mnemonic. We're asking them if they have any pain with urination or dysuria, bladder pain, costovertebral pain, which could be kidney related or kidney infection, testicular pain, or inguinal pain. Do they have any abnormal urinary symptoms such as difficulty starting the stream, frequency, urgency, hesitancy? Maybe they have an enlarged prostate that's preventing their bladder from emptying out completely. Frequency, any sores, lesions, or discharge located in and around their penis or scrotum. Do they have any swelling or enlargement? A hydrocele, which is usually just an accumulation of fluid around the testes that enlarges their testes. And then infection of their epididymis. We want to use the P's when we're collecting information about their sexual history, partners, practices, protection, as well as past sexually transmitted infections that they've been treated for. Very sensitive topic, erectile dysfunction, but it does occur in men. And this is a consistent inability to get or maintain an erection, and it prevents men from having satisfying intercourse with their partner. And this can be really considered more of like vascular related. So when a patient has a long-standing or chronic vascular disease such as diabetes or hypertension, that can lead to erectile dysfunction. We also want to ask them about cultural and racial considerations that may take place, restrictions on discussing sexual issues. So it's, again, a very sensitive topic that we need to approach with all of our patients. You're educating a young man about testicular cancer. What are the signs and symptoms? Select all that apply. If you picked A, B, and D, you're correct. A male patient is complaining of burning with urination and yellow penile discharge. What do you suspect is ailing this patient? could be a sexually transmitted infection, more commonly chlamydia or trichomonas, or another sexually transmitted infection. So when you're assessing, you want to obviously start with inspection and then move to palpation. Very similar to the female reproductive system, we want to provide a warm, comfortable room, ensure confidentiality, maintain dignity and privacy. The purpose of the assessment is to assess for any lumps, discharge, or any abnormalities. We want to use gloves when indicated, especially in the lower reproductive organs, and then identify symmetry, color, contour, edema, lesions, ulcers, texture. So starting with the breasts, similar to the female, we want to inspect the areola, we want to inspect the nipple, we want to look at the shape, size, color, position, identify any discharge, scaling, or crusting. With the breasts, we're going to have them raise their arms up, look for any changes in their axillary region, look for any dimpling, retractions, discharge, and then we'll gently palpate each side of the breast to identify any lumps, bumps, and if there are any lumps or bumps, notice the shape, size, consistency, mobility, and location. We want to, if there's any discharge or complaint of discharge, obviously wear gloves, and then gently compress each nipple and identify that. Normal findings should be that the breasts are symmetric, even, no lesions, no discharge, no lumps, no masses. Areola is smooth, nipple is everted, and the axilla has no areas of lumps. If you responded gynomastia, you're correct. Gynomastia simply means enlarged breasts, and usually related to overdeveloped fibroglandular tissue. It could be related to a decrease in testosterone levels or medication side effect. The other options were fibrocystic breast disease, which is simply just soft, densely populated cysts within the breast. Benign hypertrophy is just enlarged glandular tissue, and then mastitis is simply more in the female population, especially with breastfeeding, just an infection, a localized area of the breast that's infected. When inspecting the male genitalia, we want to assess for any masses, lesions, edema in the area. Definitely want to use gloves, and we definitely want to use a spotlight or tangential lighting. Inspect the penis, the prepuce, whether it's circumcised or not, the urethral meatus, the opening, pattern of pubic hair if there is any hair, and then identify any areas of irritation, redness, or lice. Gently lift the scrotum to assess the underside or the posterior side, and then ask the patient to turn on their side with their leg slightly bent, separating the buttocks to inspect the anus. So you're doing anterior as well as a posterior assessment. And this is just an example of how you would look at the penis, look at the scrotum, sitting on a stool or squatting at eye level, and just kind of comparing the right side to the left side. These are normal findings. Caucasians should be pink to light brown, where dark-skinned or African Americans should be light to darker brown. The scrotum should be, penis should be smooth. There should be no hair present. There should be a dorsal vein that's present, but otherwise no lesions, no discharge, and no evidence of nits or lice. The prepuce should be either circumcised or uncircumcised. Most, if they're circumcised, most of the time they've been circumcised when they were babies, and some people get circumcised later on in life, so that's information that you might want to document. And then you want to look at the urethral meatus, whether it's pink, smooth, and located at the edge, or rather at the center of the glands, not on the edge. Look at the distribution of pubic hair. Look at the scrotum. It should be a little darker in coloration, and usually the left hangs lower than the right side. Look for the inguinal area. The smooch should be skin. There should be no lumps. And again, the anus should be darker in skin color. You should not find any sores, no canker sores, no warts, no lesions, no evidence of tinea, which is just a yeast type of an infection, or penile cancer abnormalities on the penis. Abnormal findings include phimosis, paraphimosis, balanitis, pubic hair that's not well or evenly distributed or is not consistent with their age, or if there's abnormal discharge from the urethra. Page 390 and 391 in your book have these abnormal findings along with the description of each of these abnormal findings. Phimosis is simply more of a stenosis of the preputial orifice so that the foreskin can't be pushed back over the glands. Paraphimosis is usually found in an uncircumcised penis that may be covered with foreskin that once retracted now cannot return to its original position. And then balanitis is an inflammation of the skin that covers the glands. So those are just some of those terms really you should know for documentation purposes. If there is discharge, you do want to collect that discharge and culture it and send it off to the lab. Method to obtain a urethral culture includes gently turning the swab 2 to 3 seconds, maintaining contact with the mucosal surface of the glands, and slowly withdraw the swab and insert into the tube and send off to the lab. Patient education is extremely important, and really reinforcing that, male breast cancer is not very common, but they should, do an assessment of their breasts along with the testicular, and preferably in the shower where it's easier to perform both of those skills once a month at least. And it's just an example of how to perform a testicular exam, and you're just simply using the index and middle finger of their hands and placing them on their testes and just feeling and rolling the testes between and feeling for any abnormal lumps, bumps, bruising, tenderness, anything that just doesn't feel normal to them. Healthy People 2030, the goal is to improve health and well-being, as it seems that, the male population are more likely to smoke and drink and make unhealthy choices, and put off regular checkups and medical care. And our role is really to reinforce health promotion, and disease prevention. And the last two questions. A nurse is inspecting and palpating the breasts of a male patient. What should he or she inspect the areola for? If you said drainage as well as contour, you're correct. You're performing a male assessment and ask the patient if he performs a testicular self-exam. He responds yes. What should your next question be? It's important to understand how often they perform them. For men over the age of 14, a monthly exam enables early detection.